1. Shortness of breath after climbing stairs. It might be more than you think. Watch to find out. Did you know there's a condition where unwanted guests called amyloid proteins can invade your lungs and cause trouble? That's right, we're talking about lung amyloidosis, a medical mystery that's as intriguing as it is complex. 1. Uninvited guests in your lungs. The medical mystery of lung amyloidosis. Watch. Let's imagine your lungs as a well-organized house party. Everything is in its right place, everyone is having a good time, and the party is running smoothly. But then, uninvited guests show up. These are our amyloid proteins. They're not supposed to be there, and their unexpected arrival starts to cause a bit of chaos. 1. Feeling like you're running a marathon. But you just walked upstairs. Lung amyloidosis. Explained, watch now. Just like at a party, when these uninvited guests arrive in your lungs, they disrupt the normal functioning of things. They barge in, settle down, and start to accumulate. The problem is, these proteins are stubborn and don't leave easily. Over time, their presence can lead to serious health issues, disrupting the harmony of your lungs and potentially causing respiratory impairment. Think of it like having a bunch of uninvited guests at your house party. They can cause a lot of chaos. So, how do doctors spot these uninvited guests in your lungs? Just like detectives, doctors embark on a mission to uncover the truth. They start with a biopsy, a technique where a small piece of lung tissue is taken to be examined closely. This isn't a random search though, they're looking for very specific signs, the presence of amyloid proteins. These proteins, when they misfold and accumulate, can cause havoc in our organs and tissues, leading to conditions like lung amyloidosis. But seeing these proteins isn't easy. They're crafty, hiding in places you wouldn't expect. That's why doctors use different methods to type these amyloid deposits. It's a bit like identifying a criminal's fingerprint. Each type of amyloid protein has its own unique characteristics that can be detected. Knowing the exact type of amyloid protein is crucial, as it helps doctors plan the most effective treatment strategy. It's a complex process requiring careful examination and analysis, but it's a necessary step in spotting these unwanted guests and showing them the door. So, the next time you think about your doctor, remember, they're not just physicians, they're also detectives tirelessly searching for clues to solve the mystery that is your health. It's like a detective searching for clues to solve a mystery. Now, what are the signs that these uninvited guests have arrived in your lungs? It's not as if they'll knock on your door and say hello, right? Imagine this. You've just walked up a flight of stairs, something you do every day, but suddenly you're gasping for breath, feeling as if you've run a full-blown marathon. This is one of the first signs of lung amyloidosis. You may also experience cooing that just doesn't seem to go away, and sometimes you might cough up blood. It's as if your body is running a marathon without your permission. Some people may also feel chest pain or notice swelling in their legs, ankles, or feet. It's like your body is trying to tell you, hey, something's not right here. And then there are the more general signs, feeling tired all the time, unintentional weight loss, or even a low-grade fever. It's as if your body is under constant strain and it just can't keep up anymore. So if you've been feeling like you're running a marathon when you've only walked up a flight of stairs, or if you've noticed any of these other signs, it might be time to pay a visit to your doctor. It's like your body sending you a message that something's not right. It's time to talk numbers. How many people actually have to deal with these unwanted guests in their lungs? Lung amyloidosis is a rare disease. It's so rare, in fact, that pinpointing an exact incidence rate can be challenging. However, estimates suggest that it affects less than 5 out of every 100,000 individuals. So imagine if you were looking for a 4-leaf clover in a field of 3-leaf ones. That's how rare this condition is. Now, let's talk about the male to female ratio. Lung amyloidosis doesn't play favorites. It affects both genders equally. So, whether you're a guy or a gal, your odds of being that rare 4-leaf clover are about the same. But remember, rare doesn't mean non-existent. Just as you might stumble upon a 4-leaf clover while strolling through a field, a diagnosis of lung amyloidosis can come unexpectedly. Remember, knowing about these uninvited guests can help us kick them out sooner. So, what happens after these unwanted guests are found in your lungs? You might ask. Just like dealing with unwanted party crashers, the sooner you find them, the better. In the case of lung amyloidosis, early detection is critical. Once identified, treatment options can be explored, and these largely depend on the type of fibril protein causing the condition. Accurate identification of this protein is crucial for effective management, just like knowing the names of those party crashers can help you get them out of your door. Survival rates, on the other hand, can vary widely. Some forms of pulmonary amyloidosis, like the nodular type, often come with a good prognosis. But remember, each case is unique, and your doctor is the best source of information for your specific situation. And just as you wouldn't ignore a room full of uninvited guests, we should never ignore our bodies when they try to alert us of trouble. Symptoms like a respiratory impairment could be your body's way of saying, hey, we've got some party crashers here. So let's heed the call. Let's keep a keen eye on our health and ensure that these unwanted guests are shown the door as soon as possible. And that's why it's so important to pay attention to what our bodies are telling us. Let's keep those unwanted guests out of our lungs. Like, share, comment, and subscribe.